Good evening, good morning, or good afternoon, depending on where in the world you are joining us from. A very warm welcome to the launch of the IEPA's new global webinar series on early intervention and prevention in mental health. I am Maria Mikhail, the IEPA Vice President for Europe, and I am delighted to host tonight's session. The series is designed to bring high-quality, accessible research to colleagues around the world, and we are thrilled to see such a strong interest in our opening event. We've had over 100 registrations. Tonight, we focus on a topic that sits at the center of ongoing debates in schools, families, and policy circles, school smartphone policies and their impact on adolescent mental health and well-being. And we are honored to be joined by Professor Victoria Goodyear from the University of Birmingham, UK, an internationally recognized expert whose SMART Schools Study is generating some of the most important evidence we have on how smartphone use and school policies shape young people's well-being and learning.
Thank you ever so much for the invitation to join and talk to you all today. And thank you to Maria for inviting me to talk. And it's an honour to be here and talk about that. So I'm going to talk about school smartphone policies and adolescent mental health and well-being. And this is largely work based out of the Institute for Mental Health at the University of Birmingham, but also the School of Sport, Exercise and Rehabilitation Sciences. I'm the PI for the SMART Schools Study that I'll talk about, but also the training director for the Centre for National Research and Training in Understanding Behaviour, funded by the ESRC. And just before I start, I want to declare some conflicts of interest. So I was a recent consortium member for the UK Department for Science, Innovation and Technology funded project on children's smartphone and social media use. And I have recent or current funding from Birmingham alumni, ESRC, the Department for Education, NIHR and Research England that all relate to the topic of phones, social media and mental well-being. And just to state that all funds are paid to the University of Birmingham. So the structure of the talk is going to be around three key areas. I'm going to give some context and explore the current empirical evidence. I'll use the SMART schools as a case study that we can use to understand the current evidence base, the strengths and limitations, and how we can use evidence on school phone policies to inform our thinking. And I'll then consider implications for research, policy and practice. So to start with, in terms of the context and the empirical evidence, it is fair to say that smartphones in schools and whether social media use should be available for under 16s, it has been and continues to be a hot topic. It is discussed most times, particularly in the UK. We're seeing this currently discussed at the moment, and it's on the minds of lots of parents, teachers, families, clinicians, and people that are working directly with young people. It's been in the news as a prominent focus for about 2 to 3 years. Perhaps most in 2024, we saw some headline news stories about Australia passing social media ban for under 16s. And this was that policy for Australia as a landmark policy. In the US, we've seen that the Surgeon General calls for warning labels on social media. And they said a Surgeon General's warning label, which requires congressional action, would regularly remind parents and adolescents that social media has not been proved to be safe. Other headlines across Europe and across the world more globally was calling for a global ban on smartphones in schools. And there's warnings over excessive use, with 1 in 4 countries that were reported to be banning phones in schools. And these are the headlines from the last 7 days or so. Phones to be banned in schools by law in England under government plans. California to test limits on school phone ban movement. And then more updates on how it's going in Australia, with more than 4.7 social media accounts blocked after Australia's under 16 ban came into force. So we can see these kind of patterns and trends going on in the news. And what they all tend to point towards is seeing phones and social media as a prohibited item. And this type of way of thinking or positioning phones and social media is perhaps relevant to other public health challenges. For example, how we set or advise on drinking and limits, but also drinking not being available to younger populations, smoking, gambling, and also requirements on food and tackling things like obesity. So we can see that now phones in the last 5 to 10 years now have entered this type of public debate about whether they should be prohibited or whether guidance or there should be restrictions on these forms of use. We're also seeing in this space some conflicts between different forms of knowledge that are communicated. The Anxious Generation is a key book that has been used and explored and understood by many parents and many policymakers and campaign groups across the world. And it's really helped to shape the complexity in phone and social media use to those groups. But equally, the evidence informing that book has been called out to say it's not robust or rigorous enough to inform public debates. And actually, this book is perhaps in some ways not supportive of the current knowledge and evidence that comes from the academic community. So that creates a challenge for policymakers, parents, families in thinking about, well, what evidence can we trust and what evidence can we use? So it's a really complex and difficult place. We also see celebrities starting to point towards the need to prohibit phones. We see what might be classified as in research, but perhaps less in a university. We see TV experiments taking place, showcasing some of the benefits that not having phones might have for young people. But as I said, we would not necessarily be considering those findings as rigorous and robust in an academic community. We also see the documentary of Adolescence, and this was really showcasing. It was a drama, and it really did showcase how the impact of social media can have on young people's lives. And whether or not it was a drama, one thing that can be said from this documentary is that it shows quite in a deep and meaningful way how young person's social media can impact not only them and their mental health and well-being, but their families, the community workers, their peers, and their schools. So it's not an isolated aspect. We learn from this type of documentary, it cuts across all aspects of young people's lives. In the UK, the government have launched a consultation in growing up in the online world. And part of this is to consider whether social media should be banned for under 16s and whether there should be restrictions on different forms of social media use, such as whether infinite scroll should be banned or whether we should have certain curfews or screen time limits for young people. But whether or not all these different messages across public policy and the media all collide is that there is a consistent message. Young people, schools, teachers, parents, family makers, carers, policymakers, clinicians, police, social workers, and I think the list goes on, are all concerned about the potential negative impacts that smartphones and social media have on children and adolescents' development. And perhaps that's not surprising, because in the last 10 years, there's been the increased prevalence of mental health disorders in young people. Taking the UK as a context, we've seen that 1 in 5 young people aged 10 to 19 have a probable mental health disorder, and that's mostly anxiety and depression. Now, this is a challenge because we know that poor mental health impacts on other aspects of adolescents' lives and is associated with poor behaviour, school absence, low attainment, sleep problems, and sedentary lifestyles. At the same time, there's been this parallel trend, which has caused many people to associate between mental health and the harms associated with phones and social media. We see nearly universal ownership of phones by the age of 12, and that's typically when young people start secondary school. We're seeing reports that young people tend to spend 4 hours per day on their smartphones, and even higher in some cases on social media at 5 hours. And the prevalence of problematic use, although it's difficult to define and there's a lack of conceptual clarity, across Europe, prevalence rates are 3 to 14%, and more globally, we're seeing trends in 1 in 4. So we can see starts of these trends and patterns that social media is a key and phones are a key part of young people's lives. We also see the context of what's going on in schools and families. Smartphone bans are widespread in schools at the moment. there's been an increased focus on the need to develop digital literacy. And at the same time, there's other types of evidence that are being circulated. And in particular, these are case-based evidence of severe harm experienced from content and exposure to algorithms and content forms. And we're seeing key charitable organisations trying to address these issues. So one might think then, with all of this going on, what might be the options for policy? There's smartphone bans in schools, there's social media bans for under 16s, there's screen time guidance, we could be curfews, screen limits, removal of features, or developments in various versions of online safety acts, which would largely see social media companies held to account for what they promote and ensure the safety and well-being of young people on their platforms. So that's the kind of context of what's going on. And many people working in this space often turn to researchers for the answers about what to do and what can the evidence be used to guide. Now, this is a real challenge for those of us working in this space, because when asked about the question of what policy options to do, we tend to say that there is only a small but significant negative association between smartphones, social media, and adolescent mental health and well-being. At present, there is a lack of robust causal evidence measuring the impact of digital media on child and adolescent outcomes. And there are few representative experimental studies or evaluations of restricted use in children and adolescents. And this is particularly when we look at research at a population level. As I mentioned before, there are case-based examples of harm, but at population level, we don't seem to find that social media use or phone use causes worse outcomes with a large direct effect. We also see that there's been an over-reliance on self-reported measures with a primary focus on generic measures of screen time. So we see that young people are often reporting on how much screen time they've used, and this is often not contextually relevant to what they are actually doing on their phones and social media. So in the absence of a causal relationship, one thing that we can do is look to patterns in the evidence and start to think, okay, so what are the patterns in the evidence and how might that inform policy and practice and decision making? We do see many correlational studies in the last 5 to 10 years, and they consistently report associations between increased screen time and worse mental health outcomes. They tend to also show that lower and moderate levels can be beneficial for mental health and well-being. And in some cases, abstinence can lead to worsened outcomes. Now, those are correlational studies, and the challenge with that is that it could just be a case, because there's no causal evidence, of these two parallel trends that are occurring in society, and we don't know if one is causing the other. Qualitative studies in this space are particularly useful because they provide explanatory and exploratory evidence on what's going on. Qualitative studies report a mixture of benefits and harms, with content exposure, algorithms, interaction, information access, and attainment reported as supporting and hindering mental health and well-being. From both types of data, we see that there are variation in experiences by age, sex, culture, religion, location, and developmental needs, where we need to consider that perhaps living in a rural context might benefit young people to interact with their family and with their peers. We see younger populations perhaps more vulnerable, and we see differences between boys and girls in the time periods when they experience vulnerability. It's also important for some young people in different cultures and religions to be able to access information from their phones and social media. And we can also see that there are certain groups, that young people with perhaps neurodivergent needs, that benefit from having access to phones and social media, as well as those particular medical needs. So we can also look to explanatory evidence, so some conceptual theories, and the development of these theories from mainly the internet and other ways of thinking about behaviour. So behavioural theories of displacement, interference, and stimulation have been typically used to explain how smartphones and other screen-based activities have both positive and negative influences on well-being. From these perspectives, smartphones influence well-being by reducing the time available for activities that have beneficial effects on well-being, such as physical activity, sleep, or face-to-face interactions, By interrupting activities that can positively impact on well-being, such as by distracting attention away from other tasks, or by affording access to information, activities, and social networks that would be otherwise unavailable, such as apps and online content. Other psychological theories have been proposed to indicate how individuals experience negative well-being when smartphone use influences core needs. For example, self-determination theory proposes that the needs of autonomy, competence, and relatedness must be satisfied to experience well-being. In the case of smartphones, then, autonomy and connectedness may be violated if adolescents no longer have control or agency over phone access. The final developing emergent theory is about problematic use, but there is a lack of conceptual clarity. This has often been compared to other addictive behaviours, and it's basically related to a lack of self-regulation or lack of control in how social media is being used or phones are being used. And it's about impulse and reactivity. So what how do we have or evaluations of restrictions? In adult populations, abstinence and lowered screen use can lead to short-term improvements in mental health and well-being, but there is a lack of longer-term follow-up. There are few peer-reviewed studies evaluating restricted use. And there are few evaluations of school phone policies. And of those published, they tend to be reports or community-based reports. But these do tend to report on positive impacts of in-school behaviours. But the findings are less consistent with outcomes such as mental health and attainment, where these might be influenced by wider contextual factors. And overall, the evidence from these studies is quality remains low. So we have a context where there are significant evidence policy practice gaps. The evidence suggests that while some children and adolescents may experience harm, others may remain unaffected or experience positive impacts. We know that many restrictions are being implemented ahead of robust evidence of impact, and there could be unintended consequences of these policies and practices by the removal, particularly, of some of the benefits. We also know that there are few robust and peer-review-based guidelines for schools and parents on screen time, and as well as education or mediation and modelling practices. So with that context in mind, I'll present some of the work that we've done around the SMART Schools Study and how this provides an evaluation of school phone policies and what we can learn from that. Now, just to say that I present this evidence on behalf of a wider SMART Schools interdisciplinary team that involved Dr. Maria McHale that started this webinar, but also colleagues from the University of Birmingham across public health, psychology, sport and exercise, and health economics, and also statistics. We also have partners working within the NHS, UK Active, and Services for Education, and a wide-ranging research team. So this study that I will talk about is really based on it's called SMART Schools, and that stands for smartphones, social media, and adolescent mental well-being, the impact of school phone policies restricting daytime use. This was a National Institute for Health and Care research study and took place between April 2022 and July 2025. And it's a mixed methods, cross-sectional observational study. Now, the literature we use to inform this study at a very key point level is that we found in the literature at the time of designing this study was that moderate levels of use, that's particularly less than 2 hours a day, can benefit mental well-being. But we saw that higher levels of use of more than 2 hours per day can negatively impact well-being. We were also concerned about the self-reported evidence, and there was a lack of peer-reviewed studies. In fact, this was the first worldwide study to look at school phone policies because most of that was based on ecological data sets. And we also saw that impacts at this time were variation by sex and age, and this informed our study design. But what we can say about what we would think or expect or hypothesize to happen was that we thought that, similar to the Goldilocks story, you don't want too little, you don't want too much, you want just about the right amount. So in the context where we have moderate amounts of phone use are good, we were suggesting that the school phone policies could lower the amount of time adolescents are spending on phones and social media to just about the right amount. And we drew this on conceptual theories of displacement, stimulation, and problematic use. So displacement relates to too much, stimulation relates to too little, you'll deprive yourselves, and problematic use we also found would be related to too much. At the time of putting in this study started and was co-produced with schools, young people and families from 2019. And in 2019, we saw a pattern across the West Midlands in Birmingham that 60% of schools were starting to restrict phone use during the school day, and 40% were allowing phones and social media to be used. What this meant was that at the time, we thought that this study would have great public health impact if phone policies were to be successful, because they were a naturally occurring intervention taking place in school settings with a wide reach to young people. So the aim of the SMART School Study was to evaluate the impact of school phone policies by comparing outcomes in adolescents who attended schools that restrict versus permit phone use. The hypothesis was that restrictive phone policies would lower the amount of time adolescents spend on phones and social media and improve mental well-being, possibly operating through improving physical activity, sleep, attainment, and disruptive classroom behaviour. This is a quite simplified diagram of what we would expect to happen. Going from green to blue, we have a context of excessive use of phones and social media. During the hours of 9 till 3, young people cannot use their phones during the school day. This should then lead to moderate amounts of screen time, which would be beneficial for physical activity, sleep, attainment and behaviour, and in turn that would improve mental health. Now we're going from a simplified diagram to a complex logic model. And what the top part of this diagram shows is that pathway across the green and blue that you've just seen. But the point to draw your attention to is that the bottom. The blue boxes show differences between schools, individuals and adolescents, and family and home environment. And these are all contextual factors that could influence that relationship or that pathway from phone use to mental health outcome, but also can influence mental health outcomes themselves. So whilst we might expect a neat relationship, we also thought that it might be complicated and complex. If you want to know more about the study protocol, we have a protocol published in the BMJ Open, and this provides the further information on the background to the study and how we designed the study and the main research questions were put together. But what I'm going to talk today about is a multi-method study. This explores 4 components. The first component was a policy analysis. The second was a cross-sectional observational study. The third, a health economic analysis. And the fourth being a qualitative comparative case study. So the first is the policy analysis. And what we did with this part of the study is we analysed 30 schools that were in this main study sample, and we analysed the policy documents that were reported about their smartphone policies. We also conducted a survey with senior leadership team members in schools and pupils. The key findings from this part of the analysis were that schools and teachers want phone bans to improve attainment, behaviour, and reduce safeguarding issues. They perceive that phone access is important for safety for travel to and from school, for learning and the ability to complete homework, and for communication with parents. What they agreed on was that pupils and teachers prefer phone use to be restricted in the school classroom. And from this policy analysis, we identified some broad categories of what different types of policies that we were seeing implemented in schools. We had a context of permissive school phone policies, and that really meant that phones were allowed to be used at any time, and that phones are allowed to be used at certain times or in certain zones. And in restrictive schools, we saw that phones must be kept off and inside bags. Phones must be kept in lockers, must be kept in a pouch, or phones must be handed in, or phones are not allowed on premises. And those latter 4 policies were really what we would classify as the more strict policies, because they are largely regarded as being inaccessible. Now, at the time of doing this policy analysis, we started doing this in 2022. Compared to 2019, there was a shift in the number of schools that had started to implement restrictive school phone policies. The sampling frame of 1,345 schools across England now was made up of 90% of schools with a restrictive policy and 10% of schools with a permissive. The second study was a cross-sectional study, and this was an observational study that involved a sample of 1,227 pupils aged 12 to 15 from years 8 and year 10. They were from 30 schools, 20 with restrictive policies and 10 with permissive. Data collection took place from November 2022 to November 2023, with the primary outcome of mental well-being. We also looked at anxiety, depression, problematic use, and these were self-reported, phone and social media time, and these were phone and self-reported, physical activity and sleep, which were reported from accelerometers, so wrist-worn trackers, and disruptive behaviour and attainment reported from English and maths from teacher reports. In terms of sampling and analysis, we used a stratified sampling approach using propensity score tercile groups. And what we aimed to do here was we used routine data from the Department for Education on 10 key school characteristics that we thought might influence wellbeing outcomes. And the reason that we sampled in this way was to ensure that the two school groups were broadly comparable and any differences could not be attributed to particular factors, such as the location of schools or the proportion and makeup of pupil demographics. The analysis involved mixed effects linear regression models and included pupil and school level covariates as fixed effect adjustment variables. So the key findings were that there was no significant difference in all outcomes for adolescents who attend a school with a restrictive phone policy compared to a permissive phone policy. And we saw no statistically significant interactions with school phone policy for mental well-being across sex, year group, ethnicity, and socioeconomic status, meaning the impacts were broadly comparable across the population in the study. A significant difference in time spent on phones and social media in school, but there was no significant differences for a weekday, weekend, or a week. And what we did see was that in restrictive schools, adolescents spent 40 minutes less on phones and 30 minutes less on social media compared to permissive schools. A significant association was found between time spent on phones and social media and the outcomes, with higher time spent associated with worse outcomes, with the median time spent on phones as 4 to 6 hours per day and 2 to 4 hours per day on social media. What this diagram shows is that across all of the outcome measures, the only significant differences observed were smartphone time in school and social media time in school. So why did this happen? Well, one explanation is that screen time overall was between 4 to 6 hours per day and 2 to 4 hours per day on social media. The school reduction of 40 minutes and 30 minutes was not enough to make a difference. Going back to our diagram from green to blue, we see a context where 4 to 6 hours on phones and 2 to 4 hours on social media. This was reduced by 40 minutes and 30 minutes, still leaving a context of excessive use. So no change to the health behaviours and no change to mental health outcomes. We also did a sensitivity analysis to unpack what was going on, and no differences in outcomes for school with more restrictive policies were observed, so those with the lockers or the pouches. We also found no evidence of compensatory use for pupils in restrictive schools, and in-school phone and social media use was only a small contributor to overall use on school days and at weekends. We then looked at a health economic analysis, and what this health economic analysis does is compares both the costs and wellbeing outcomes associated with school phone policies, and can help decision makers understand the costs or cost savings that phone policies may occur alongside any wellbeing benefits for pupils. The key cost that we looked at was staff time, implementing a phone policy or managing the consequences of phone use. We looked at quality of life and mental wellbeing outcomes were collected from 815 pupils across 20 schools. Time spent managing phone use each week was provided by a senior leader from each school for different school staff groups. And salary estimates were attached to reported time use data to obtain cost estimates. The costs and outcomes were extrapolated to 39-week school year for the economic evaluation. The key findings were that implementing phone policies in schools places a significant demand on staff time, where the typical UK-sized secondary school spends an average of 100 working hours per week managing phone use. Schools with restricted policies spend around 102 hours per week, which is the equivalent to 3.1 full-time staff implementing enforcing policies. We see in these schools that more time is spent applying behavioural sanctions for policy breaches, such as detention and parent communication. Schools with permissive policies spend 108 hours per week, equivalent to 3.3 full-time staff implementing and enforcing policies. More time is spent recording behavioural incidents, training and communicating information to school staff. There were no differences in the quality of life and mental wellbeing outcomes between pupils in schools with restrictive and permissive policies, confirming the previous study's findings. The fourth component of the study is a qualitative case study. This involves 7 case study schools, 4 permissive and 3 restrictive, 40 focus groups with 177 pupils, school staff and parent participants, and thematic comparative analysis. The key findings from this study were based on 3 types of behaviours. The first being interactions. Here, restrictive schools saw a perceived increase in face-to-face interactions and friendships between students. Permissive schools enabled students to incorporate phones into their actions, and vulnerable and socially anxious pupils used phones to feel less excluded. In terms of behaviour, we saw that in restrictive schools saw out-of-school social media interactions result in face-to-face issues such as conflicts or fights in school. But in permissive schools, saw an escalated of phone-related behavioural issues, such as including getting mugshots of pupils with staff concerned about pupils taking their photos and contacting them out of school hours. Pupils at restrictive schools made up for lost time during the school day, leading to the displacement of physical activity and sleep. Permissive schools saw students more likely to self-regulate phone use outside of school, such as by charging their phones downstairs at night, using screen time limits, and deleting apps to curb use. And this diagram really explains that relationship. We see that restrictive phone policies reduce phone use in school. That can lead to the displacement of physical activity and sleep, improve face-to-face interactions, improve friendships, but also an increase in face-to-face conflicts. Adding to this diagram is also evidence of learning, where the absence of phones was causing distraction and anxiety. In permissive schools, we saw that phone use behaviours were allowed. There was recreational use in school. In some cases, this supported the self-care of emotional well-being. It mitigated social inclusion, but it led to an increase in safeguarding and bullying issues. It promoted self-regulation of use, but the presence of phones were also distracting. But all of this was all influenced by different contextual factors, such as by the school, parents, and pupils' individual needs. And I've just included some quotes here to highlight these contextual factors. This is from a pupil. We're not taught how much we should stay on our phones, though, and when we should know when to come off it. I know that on Wednesday, I had about 7 or 8 hours on my phone, and on Saturday, about 12. I know in my head that's too much, but I don't know how to come away from it. One thing that concerns me from a mental well-being perspective is that actually we're eroding students' confidence and resilience. A case in point would be that if a student feels sick in school, the expectation is they're sent to our medical centre to be reviewed by a first aider, and for a call to be made on whether they come back to their lesson or they're picked up from school. We've noticed a huge surge in being notified that such as parents have arrived at school to collect their child, and you'd be like, sorry, they've not even been to the medical. The child has taken themselves to the toilet, phoned the parent, their parents come to collect them from school. We're not teaching those children any resilience. We're not teaching them that they need to wear the process. It's not being supported by parents, and it's become combative. Final quote to share with you is from a group of teachers. That presence of phones is going to be helpful, especially for the vulnerable ones that don't have many friends. For those children, having a phone is a prop. Sometimes phones can bond people together, particularly if they're playing a game or they've seen something that can stimulate conversation, or they can be busy rather than sticking out like a sore thumb. You could think about the kids who are more kind of introverted, and it's negative for them because where previously they would kind of be forced into a situation where they're talking to people, but equally it gives them something to do and it gives them a bit of an escape. If students are coming to school and they've got situations going on at home, school should be that safe place where they can forget about that, crack on, and it does also allow them to relax. So bringing this all together, I'll consider now the implications for research, policy and practice. But just to highlight, what are the key messages from the SMART Schools study? The first is that we see here from this study findings is that phone and social media use is effectively 24/7. There is a need to consider phone use within adolescents' broader lifestyles and impacts across physical health and education. A focus solely on phones and social media, we risk overlooking other factors that may contribute to mental health outcomes. And technology-free spaces are likely to be important, given time is associated with worse outcomes. Other key messages are that school phone bans alone are not enough to tackle the negative impacts of phone and social media use. There are a mixture of positive and negative impacts, and there may be unintended consequences from restrictive policies. Phone bans don't eliminate the issues from occurring, they change how they happen, and that has implications for school and family life. Time spent focusing on managing phones in schools could be diverting staff time away from other wellbeing promoting activities. So what are the implications? Reducing screen time is an important focus. Given that more time on phones is associated with worse outcomes, new approaches are needed to tackle screen time. Different types of policies are needed that focus on in-school and outside of school phone use, and schools, families, and community settings need to be involved in creating these policies. Schools require support. Schools need to be supported to develop new approaches to manage phone use, training, and help with implementing new policies without absorbing large amounts of staff time. And there is a need for holistic approaches where tackling phone and social media use needs to be linked to wider approaches to supporting health and well-being. And there is a need for further evidence because we currently lack an evidence-based practice approach to addressing phone use, and all new approaches need to be accompanied by robust evaluation. So based on this body of work, one thing we were asked to consider by the British Medical Journal was what might be alternatives to. We wrote this article considering from a child rights perspective, focused on supporting the healthy development of children and suggesting that this requires an approach underpinned by age-appropriate design and education. Age-appropriate design refers to how smartphones and social media need to be designed in ways that address mental well-being, considering content, algorithms, and privacy. In education, adolescents, parents, and teachers require new forms of education to support the development of healthy technology use and to help adolescents thrive in a digital society. So I'd like to finish on those points and just like to thank you all for your listening in and being able to speak to you about this body of research. Thank you very much.
Wonderful, Vicky. Thank you so much for such a clear presentation on what is a very complex topic, isn't it? We'd like to open now the platform for questions, comments, or observations from our delegates. So we've spent the next sort of 15, 20 minutes on hopefully having some interesting conversations. So while I'm waiting for people to post their questions, I've got a question, Vicky, if that's okay for you. I think it's fair to say so some of the findings of this ongoing program of research are not necessarily policy palatable, and they might be perceived as going against the trend or the current policy narrative, not just in the UK, but internationally. And I think that's sort of supported by the global landscape that you provided earlier in your presentation. So how have you managed to present these findings to policymakers or government advisors in a way that it's policy palatable?
Well, we've talked to them. I'm not sure we've achieved that, but I think the key message from this body of work is that it doesn't say necessarily we should ban phones in schools. Neither does it say we shouldn't. What it says is that school phone policies alone are not enough to tackle the negative consequences of phones and social media. And when we approach that from thinking about in practice how we work with young people, we know that thinking about different communities, systems, and contexts that they work across, that we need those holistic approaches. So when we get behind the findings of there was no differences, and we can think about how we support adolescents to thrive in other settings, we know that we need to tackle that issue holistically. We need to focus on more than one thing, and we need to focus on in school, outside of school. We need to focus on physical health, mental health, education, and all those factors. So yes, the headline findings are not supportive, but when you go behind the headlines and think about what the study shows, is it is consistent with other approaches to public health and mental health.
Wonderful, thank you very much. And I know you spoke earlier about involving young people and having young people at the front and center of designing these policies. Are we doing that? Are we doing enough?
So in the SMART Schools study, the study was very much co-produced with young people. I think there are lots of work based on co-production with young people and how that supports them. I think when we talk to young people about smartphones and social media and bans, they are critically aware of the risks and they can make judgments. What the general pattern tends to be is that they're aware of the scrolling, they're aware of time wasting, they showed that quote, they're aware of some of the sensitivities and issues. But what they are challenged with and this has come across in our research for over the last 10 years, is about control. Now, young people can be very much in control of social media. They can be using it for interactions, peers, homework, safety, all those sorts of things. But phones and social media are very powerful mediums, and they can switch because of that powerful nature. It can quickly switch from being in control of it to it controlling them. And that's the bit that they need support with. And that's the bit that they cannot achieve on their own.
Thank you. Thank you, Vicky. We have a question and a comment. So fantastic presentation. I'm curious how we separate the impact of social media and cell phone use generally.
It's a difficult question, because we find that 90%, certainly in the UK, 90% of smartphone use is used for social media, particularly among girls. So separating out those is quite a challenge. What we can see from the SMART Schools Study is that with the time spent on, again, that replicates that pattern. It's very much similar and comparative. So I think we need to look at the functions in use, and that the majority of smartphone use relates to social media.
Next comment and question. Lovely presentation. Thank you. I have two questions. Did you compare the decision makers who made decision about restricting and permitting? This is the first one.
Yeah, so senior leadership teams were involved in the study, so the surveys. That was mainly in the policy analysis, but they were also included in the qualitative study, in the focus groups, the fourth final study. And we generally saw that decision makers were all acting in the best interests of young people, whether they had a permissive or restrictive policy. And they all felt that the decisions that they were doing were supportive of young people. And so that was a general approach. And there were variations in how policies were implemented across schools, but the decision makers were all acting with children's best interests in mind.
And the second arm of this question is, do we need an intervention for helping young people manage social media and smartphones themselves? Example, improving self-esteem with guidance about how long to spend on social media, etc.
Yes, absolutely. Yes, we do. We do absolutely need more experimental studies, more evidence of positive solutions, whether that be education, whether that be psychological interventions. Young people do want more support in how to manage their phone use. And that, if that evidence is produced, then that can inform screen time guidance and wider approaches to supporting family and home practices.
But also parents, right? Let's not forget parents. I've recently had very similar conversations with my own son about use of smartphones. So it's a difficult landscape to navigate as well. I have one more question. How is this work informing digital literacy? One of the quotes highlighted young people wanting more information and support on how to manage their use.
Yeah, it's an important point. And one of the things that was raised from that fourth qualitative study, it was difficult to fit everything in, was that young people reported that the advice and guidance in schools and the curriculum is often outdated and irrelevant. And they would like to be able to have open conversations with schools, but also their parents as well, about misinformation. And I think the challenges are that the digital literacy needs development in schools. So it doesn't provide evidence on necessarily how, but it provides evidence on what we need to do and the importance of that topic.
And the study focused on secondary schools.
Yeah.
How transferable are some of these findings to younger kids?
I think it's a bit of more of a mixed picture in primary schools, because not all children have a phone in primary schools. We do see a sharp rise from age 8 onwards. And there tend to be patterns in phone ownership where the older siblings have a phone. So that makes a difference. But it's more uniform in secondary school whether they have phones and whether they have access to social media. But in terms of the key findings around displacing physical activity and sleep, those the sorts of things do occur. But younger children tend to have more oversight from their parents, and as adolescents grow, they grow up. Their risk-taking behaviours develop, their vulnerabilities fluctuate, and so perhaps the vulnerabilities are more at the forefront. But it's not to say that the same behaviours aren't occurring in younger populations.
We have one more question. How do you think this field is going to evolve over the next few years? And how will it change when the adolescents of today are the decision makers in schools and research and as parents in the future? What a fantastic question.
I have no idea how it's going to change. The pace of this study, we had no idea when we designed this study that it would be shaping decisions like it has. I think, today's parents are dealing with generational divides in how they grew up with phones and social media and how their young people are experiencing it. I think, to be honest, the new challenge is AI. And so there seems to be always a new trend that parents are going to be catching up on. And the challenge for us now is to ensure that we're future-proofing the future and we're not getting outpaced by the technology. So hopefully the future generations will be more informed and can learn lessons from them growing up with social media to make decisions about their children and whatever harms or online experiences they might be having.
And any advice or any reflections for clinicians, for example, primary care practitioners, who, at least in the UK, are the first port of call when it comes to mental well-being and distress? What sort of questions should we be asking young people?
Well, I think the Chief Medical Officer's guidance in 2019 is still relevant in this space. And it talks largely about having, some people might refer to it as a digital diet, other people refer to it as digital balance. And that's about having balance and the context in the use of digital technologies. So are they getting enough sleep? Are they having physical activity? Things like are phones at the table? What are the eating behaviours and those general sorts of what do we know about young people and what supports their mental health and well-being? And in what cases is phones and social media negatively impacting or obstructing those aspects? And to deal with that approach. Now, some young people, they might do physical activity, they might do it all day, and they would use their phones to relax, self-regulate their moods. And we did see that in our study as well. Some other young people might not go outside because they want to be on their phones. And so that might be, there are different types of contexts of use. So the screen time is often not quite a true representation of what young people are doing. And the other thing to think about is there's lots of things have evolved, and key questions are about what are you looking at? Who are you interacting with and why? And that might be informing certain behaviours when they present to clinicians that need to be unpacked and further understood. So I think it's looking behind what's going on, what's the context behind what's happening and why.
Absolutely. Thank you, Vicky. And can I just a final question for me before we end the presentation? Some of the personal reflections of having been involved in this complex piece of research over the past few years, Vicky, and having to balance, sometimes conflicting perspectives that are coming your way.
Yeah, I think there are lots of conflicts in this space, and I think because it's such a it's as I said at the start of the talk, it does impact on all aspects of young people's lives. It impacts on the teachers, the community workers, the families, the brothers, the sisters, it impacts on everyone. And most often people have a story or experience, or they know someone with a story, or they've seen something, ironically, on social media, the story. And so everyone has an experience and everyone has an opinion. And I think what the challenge is for researchers in this space is that they provide case bases of evidence, and they provide that. And what we do is look at it as a population level. And that's just something to be remembered, that, there are different types of evidence and there are different experiences, and everyone experiences and should be taken into account when making decisions. And we need to consider all types of evidence in that state.
Absolutely. I can see there's one more question that's popped up. Thank you very much for this wonderful presentation. I see so many parents and children at the restaurant or in outdoor settings looking at their phone rather than interacting face to face. Were the parents' screen times taken into account in this study? And if so, did it affect the children's mental health and well-being?
So there is a fifth component to this study, which is the family and home uses, and that is currently in the publication process. And I'd be happy to share that beyond this talk if of interest. But what we do know is that parental uses of phones and social media generally are reflected in young people's uses of phones and social media. So there is an association. Again, it's not causal, but there are associations on that relationship.
Thank you, Vicky. And a final comment from one of our delegates. Thank you very much for a very enlightening presentation. And on that note, I would like to thank you myself, Vicky, on behalf of the IEPA, for kicking off our inaugural IEPA Global Webinar Series. So very, very grateful. I would also like to thank all our delegates for attending today. We hope that this session informs your research, your practice, it sparks new conversations, and supports better decision-making for young people. In terms of future webinars, we will be announcing our second webinar, so please keep an eye out. If you are not an IEPA member, please do join the IEPA. There's a free membership. For those who are members, we will be disseminating shortly the details of the second webinar. So again, a very warm welcome, Vicky, and goodbye to all our delegates. Thank you very much.
Thank you.